The Treatment Action Campaign has added its voice to those raising concerns around the implications of U.S. President Donald Trump's order freezing aid to South Africa. Joining us to discuss the real impact of the decision to freeze aid is National Chairperson for the Treatment Action Campaign, Sibongile Tshabalala. Good evening, Ms. Tshabalala. Thank you very much for joining us on the program. Let's start with the role that TAC and RRR has been playing in the HIV treatment space to almost put into context the gap that this termination of funding by the U.S. would leave.
Good evening to you and the viewers. As Treatment Action Campaign, we are very devastated about the U.S. funding, and this means that we are worried a lot about the lives of the people, especially those who are living with HIV. As you just indicated, TAC and RRR have been working for past 7 years under the Project RRR to monitor healthcare services, especially to HIV services and treatment, to say how people are receiving their treatment, how are they treated in their facilities, and that project has yielded good results in terms of supporting the patient and the healthcare system as a whole. So we are very worried because by these funding cuts, one, we are seeing that people will die, and we know that more than 15,000 people have lost their job, and it's extremely concerning that all the gains that we've been getting all these years fighting HIV and AIDS, now we are going to be just diminished just like that, just because of one person's decision.
So essentially, you as TAC under RRR basically adopted health facilities, and what you would do at these health facilities is hold the government accountable.
Yes, not only the government accountable, but also we were assisting PEPFAR to see and hold them accountable on their promises and commitments that they made in the country. So as much as we were funded by PEPFAR through UNAIDS, this program was not only holding accountable the government, but was giving also PEPFAR a chance to fix where they promised to fix, but also, more importantly, it was giving communities or patients a space to engage with government officials and to tell their frustrations and their stories. And that made it easier for government and communities, patients, to be able to listen to each other and understand what you are going through as patients on the ground and as people living with HIV.
All right, so it's been overall monitoring of the HIV treatment space. But we understand that RRR right now is in the process of retrenching staff. Is this in fact the case?
Yes, it is. That's the case because also we are affected by the funding freeze from PEPFAR, and unfortunately we can't sustain the program with the full staff members. But we are also looking at other funding avenues to say how can we make sure that the project doesn't end totally, and we are restoring our dignity on the ground and continue to do what we do best in terms of advocating and monitoring healthcare services for people living with HIV.
We also understand that the withdrawal of PEPFAR-supported NGOs from these clinics is already being felt, with waiting times at clinics now being extended. Just talk to us about this.
Yes, through our interventions, we were able to reduce the long waiting times, because if you remember at the earlier years, people were waiting in the clinic 4 to 5 hours, but through our intervention, the hours have reduced to 2.5 hours, 2.5 hours at least. And then also we managed to see a 42% increase in people getting a 3-month treatment supply, of which I think, if you remember, on the World AIDS Day last year, 2024, we marched in East London to demand for 6 months multi-month dispensary, which we are hoping also that the government will work onto that, because we've seen some circulars last few weeks that were rotating regarding that. and also the increase of using pickup points, it has increased with 47% in mostly of the areas that we've been monitoring. That shows that the community monitoring project, it has yielded good results.
All right, Sibongile, thank you very much for joining us this evening. That was National Chairperson for the Treatment Action Campaign.